Anaesthesia is derived from the Greek for without feeling. There are many different types of anaesthesia, but the most common one in veterinary medicine is general anaesthesia, whereby an animal is rendered unconscious through the use of various anaesthetic agents. Like in a human hospital, general anaesthesia allows vets to perform procedures without the patient being conscious of pain and discomfort. However, in some circumstances, such as dental cleaning, general anaesthesia is also used to ensure an animal remains still. Anaesthesia is very complex, involving several distinct stages. Throughout the anaesthetic period, your pet is closely and carefully monitored, from initial preparation to complete recovery. On the day of a planned procedure, the animal is fasted for a predetermined period. This is very important because animals may vomit during anaesthesia, leading to respiratory problems if inhaled. Often, a vet will give the patient an injection prior to the anaesthetic procedure, which provides some tranquilization and preemptive pain relief, but does not cause loss of consciousness. Unconsciousness may be induced by an intravenous injection or anaesthetic gas. There are quite a number of different drugs available to your vet, with different types of effects and side effects. Your vet will choose the drugs that best suit the procedure and your pet. Once anaesthetized, a tube is passed through the mouth into the trachea to supply oxygen, maintain an open airway, and to deliver other anaesthetic agents. Modern anaesthetic drugs are very quickly eliminated from the body, so at the conclusion of the anaesthetic, animals usually wake up rapidly. Complete recovery to normal will depend on factors such as other medications used, the procedure, and the health status of the animal. Anaesthesia takes place in most Australian vet clinics almost every day. Anaesthesia is used in both elective procedures, such as spay and castration, and for emergency situations. In preparation for your pet's anaesthetic, be aware of the following. Usually, your vet will require your pet to be fasted, which will include both food and water. Check with your vet when your pet is required to fast. If your pet is on medication, check to see if you need to administer it and at what dose prior to admission to hospital. Also, you may be required to bring the medication in with your pet. There may be a pre-anaesthetic exam on admission, so please allow time for this when you drop off your pet. This is also the time to let the vet or nurse know if your pet has been showing unusual signs or has been unwell. Remember to bring a lead or carry cage and perhaps a familiar blanket. If you have a rabbit, rat, mouse, guinea pig or ferret, make sure you bring some of their food, as eating soon after anaesthesia is important for these animals. When you pick up your pet, they may be a little sleepier than usual. If a surgical procedure has been performed, they may have stitches and medications to take home. Be sure that somebody is at home with them as they fully recover. The effects of anaesthesia can be variable and will depend on things like the procedure being performed, the health of the animal, and the drugs used. These days, modern anaesthetic agents are rapidly eliminated and animals tend to recover very quickly with few residual signs. Just like in human medicine, anaesthesia is not without risks. However, modern drugs reduce these risks by having minimal impacts on the vital organs of the body. In addition, your pet is closely monitored using a variety of devices and direct supervision. Vital signs such as heart rate, respiratory rate, blood oxygen levels, and blood pressure are typically monitored closely. To discuss anaesthetic risks further, please ask your vet. Vets always try to minimise pain. While anaesthesia is not painful itself, the surgeries that are performed can sometimes result in pain. Vets combat pain in several ways, including administering pain relief before, during, and after a procedure, and by using gentle surgical techniques. When your animal comes home, he or she may be quieter than usual. This is normal and will probably wear off within a day. Usually a small meal can be provided, unless otherwise stated, although sometimes pets don't immediately feel like eating. Always be mindful of any medications or specific instructions that your vet has given you. If you feel like your pet is not acting the way you expect or is in pain, contact a vet as soon as possible.